Hi, I'm Dr. Michelle Kittleson, and I'm a cardiologist at the Smith Heart Institute at Cedars-Sinai in Los Angeles, California, as well as a member of the National Guideline Writing Committee for the Hypertrophic Cardiomyopathy Guidelines, which offers a clinician's guidance on how to care for patients with hypertrophic cardiomyopathy, and I care for many patients with HCM myself. Welcome to this podcast episode, Making an HCM Treatment Plan with Your Doctor and Healthcare Team. This is part of a 4-episode podcast series called What You Need to Know About HCM. Today, I'm speaking with someone who's living with hypertrophic cardiomyopathy, or HCM, and also happens to be a patient of mine. Kim, welcome to the program.
Hello, Dr. Kittleson. Thank you for having me today. I was first diagnosed with hypertrophic cardiomyopathy in 2017. We first met in 2022. I'm 57 years young, and you and I are working on a great program together to keep everything going.
Well, I'm pleased to have you with me today because we are going to talk about some very important topics when it comes to treatment plans and working with the HCM healthcare team. And your personal journey and experiences are going to be very helpful for our listeners. We're going to be talking about what treatment goals are for people who live with HCM because these can be different for different people. And we're also going to talk about how patients and their care partners can have that discussion with their healthcare team so that you can be an active participant in your care when it comes to the treatment plan. And because treatment plans can differ, it's going to be important to make personalized decisions based on individual needs. And finally, we're going to talk about some tips to help empower people to engage in shared decision-making around their treatment. So to kick things off, Kim, can you tell us a little bit about your experiences with getting diagnosed with HCM?
Yes, absolutely. So I went for my standard rheumatoid arthritis appointment. I went in and had my normal checkup with my doctor, and he noticed that I had a murmur. And then he referred me to a local cardiologist in the area that I live. And at that point, we did a bunch of tests, echocardiograms, stress tests, all the list of things that I had to go through to get the official diagnosis with hypertrophic cardiomyopathy with an obstruction, which is a mouthful, as you can tell. So that was right around 7 years ago. And my symptoms progressively got worse. And because my cardiologist was asking questions and having good patient care, I would say, listening to me and my situation and my story and being active, I was getting very winded. And he suggested that I go and visit you.
And here we are now working together. So just to remind our listeners, we can review a little bit about what HCM is. It's a condition where the heart muscle is thicker than normal and gets in the way of the flow of blood. The thickening of the heart muscle can make the heart pump less efficiently, which results in decrease in the flow of blood being pumped to the body. It often affects the septum, which is the muscular wall of the heart that separates the two bottom chambers called ventricles. And when the septum becomes thicker than normal, it can obstruct the flow of blood out of the heart, hence the term obstructive hypertrophic cardiomyopathy, which is the most common type. Sometimes that obstruction causes a heart murmur, which is an additional heart sound caused by that swirling and high flow of blood through the heart. So your story is very common. Sometimes we hear a murmur during a physical examination. It may tell us there's a problem with the blood flow, the next step being that echocardiogram that you had, the ultrasound of the heart. So like Kim, many people can get diagnosed when their doctor hears a heart murmur. There can be other ways as well. Some people have symptoms. Sometimes it's screening that leads to another test like an echocardiogram or electrocardiogram. And when I met you in the summer of 2022, after you'd been diagnosed and living with HCM for about 5 years, at that point, as you noted, you were having symptoms. So can you talk a little bit about what your symptoms were like?
Yes. So my symptoms were basically just short of breath, being winded, doing basic things, bringing my groceries from the car to the house. I babysit a little child, and even carrying him from the car to the house, I would get winded. And that was not something I was willing to live with.
So your cardiologist had talked to you about different options. I think he even sent you to a lung specialist at one point. Inhalers didn't work. And the symptoms you're describing, this inability to exercise, shortness of breath, getting in the way of activities, can be common for some people who are living with HCM. And in all cases, one of the things we're going to be looking for are symptoms. Were there symptoms as a child growing up? Are there symptoms now? It can develop at any point in someone's life, and sometimes people have symptoms for years before they get diagnosed. Those symptoms may be, like you, the exercise intolerance or shortness of breath that occurs with activity, feeling your heart race, chest discomfort, fatigue, dizziness, lightheadedness, even fainting or passing out episodes. Sometimes hot or humid conditions make things worse because people are vulnerable to dehydration, which worsens symptoms. At other times, there can be swelling in the ankles, feet, legs, or abdomen. So your cardiologist did everything right. He gave you the right diagnosis. He knew that you had HCM with left ventricular outflow tract obstruction to the flow of blood from the thick walls of the heart seen on your echocardiogram. And knowing whether there is that obstruction is really important when it comes to making a treatment plan, because there are different options when that happens. So you were having symptoms, shortness of breath, limiting your exercise capacity. And when we first met, you told me this quality of life was not adequate. And for us as doctors, it's important to have clear communication about symptoms because that guides shared decision making and looking through the different treatment options, interpreting them through the lens of a patient's goals and preferences. So tell me, can you talk a little bit about how you were feeling about your diagnosis?
Yes, absolutely. So, side note, thank you for reminding me about my symptoms of being tired and wanting to take naps and, being winded all the time. Walking up a flight of stairs was a struggle. Those were all things that I had then. And since I'm on a good treatment plan, those things have kind of vacated my mind and I forgot all about those times. So thank you for that reminder. So back to your question. So when I was first diagnosed, I did have options of open heart surgery, which sounded terrifying. And that would have been the last resort to crack my chest open. Didn't sound very exciting, especially having family members having their chest cracked open for different reasons. And that just was not fun for me at all. So it was important for me to be able to breathe. Very important. How long of a lifespan was I going to have? Will I ever see grandchildren? If, that's in the future. Being able to snowboard and just having a great quality of life. If and when I become a grandma, I don't want to have a wheelchair with oxygen tanks. I want to be able to run, skip, and be merry and have fun with my family. It's very important to me to not be a couch potato.
Amazing. You want to be the cool grandma. I support that. And you bring up a great point that is very important for patients to talk about with their healthcare team, because every patient experience is unique. So your team should ask you. And if they don't, you should feel empowered to bring your concerns up with them. Address the elephant in the room. So to know that Kim's major concerns included her decreased quality of life and concern about longevity was hugely important. And this is something the treatment plan needs to address as well. And it's important as healthcare professionals to relay to patients the appropriate optimism of living with HCM, that we know that most people who live with HCM do well and can live a long life comparable to that of the general US population who doesn't have HCM because of so many amazing advances. And then knowing that feeling the way you felt with exertional shortness of breath was not what you wanted, we have to think about what can we do to improve quality of life. Because when we look at treatments for HCM, one of the main goals is to relieve symptoms, improve quality of life, and then to think about managing and preventing long-term complications. There's so many things we could do. So Kim, when we looked at your treatment plan, we looked at all the different options from medications all the way to cracking open your chest, and we adjusted it until we found what worked for you. And it was really gratifying because I could tell it truly made a difference in your quality of life.
Yes, it is amazing. You just have to be an advocate. You have to see the right people. I am very fortunate that my cardiologist that I originally started with in 2017 diagnosed me properly. I was on a good path. New things come out, and he approached me with, like, maybe you should go see a doctor that's an expert in this field. He would only see a handful a month, whereas Dr. Kettleson sees hundreds a month, I'm going to guess. And I'm happy that I was able to squeeze into a time slot, and here we are together today. But, I am lucky that my existing cardiologist was professional enough to say, go on, get.
No, I totally agree. I think it's such an important point that we all like to say medicine is a team sport. You can't know all the answers, but you have to know how to ask the right questions and find the right answers. So I give your local hometown cardiologist a ton of credit for saying, I don't have all the answers, but I think there might be someone who has more answers than I do. But I think for our listeners, it's important for them to also know that if you're in a situation where your doctor isn't offering that second opinion, but you feel that you're not getting the answers you need, you should absolutely feel empowered to say either to the doctor, hey, do you think it's worthwhile trying to find a specialist for this condition? I think it's kind of rare. Or on your own, doing the research through patient advocate education societies that exist to get more information. Because HCM is a chronic disease, which means it's long term. And that means you're going to be working on your treatment plan over time. Your plan may change, your team may change, your plan is going to be individualized, meaning we'll pick which direction to go based on your individual needs. Someone's needs might be being a cool grandma, and other needs might be different, but that's why it's important to have these expert opinions. And it's definitely going to be a relationship between the patient and the doctor, this shared decision making. I like to say, I am the medical expert, but you are the boss of your body. So we make the decision together, incorporating my medical facts and your goals and preferences. That, in essence, is shared decision making. So we'll have a discussion about the potential options, explain them, provide what we consider to be medically the best case options. But there's often an art to it that depends on your preferences for care and treatment and asking any questions you have. So letting your doctor know about your lifestyle and habits and how treatment will be incorporated into that makes a huge difference. You might not think that a patient might say, please crack my chest open to make me feel better. But you know what? There are some patients for whom their values and goals and preferences center around not taking a medication for the rest of their life, and another fix works better. So that is why an understanding not just of the medical options, but a patient's priorities makes a huge difference. So we're creating a plan together that is the best chance of being successful and meeting the goals of treatment. So, Kim, it's terrific to hear that you felt better after having your treatment plan adjusted. It's particularly rewarding as a doctor because I read all the scientific studies and they're all dry and scientific and they just tell me the bottom line. But there's no substitute for seeing a patient sitting across from you in clinic actually feel better. A patient experience is worth 1,000 words. I love that. But tell me, were there any challenges you faced with your treatment?
I would say the biggest challenge or the worst part of the whole thing was driving up to Los Angeles. And from where I live, I had to leave 2 hours before my appointment. And that was just the first 3 months so they could monitor how things were looking and everything was going as planned. And then once we went past our 3 month mark, we were on a maintenance program. So now poor Dr. Kittleson only gets to see me once every 3 months. But her team is amazing. They're lovely, lovely people, very sweet, compassionate, and all those things, and good listeners. But, driving 2 hours each way was not ideal. But the way I feel, you got to weigh out the pros and cons. So it's a win all the way around.
And no question, the frequent visits for echocardiograms and follow-up can be challenging, but there are ways to work around it. There's ways to do telehealth appointments or local echocardiograms. It's going to be something important for patients and their care partners to bring up with the healthcare team, because if you can't get to your appointments, there's going to be a problem with your care. So figure out those telehealth type creative out-of-the-box solutions. Your healthcare team can help you if they know what the problems are.
The healthcare team has been very compassionate with the whole situation, because I was calling them and messaging lots of questions once I first started my treatment plan, because you have to make sure everything you're taking, your current prescriptions, nothing conflicted. But they were patient, and hopefully they got a good chuckle with some of my questions. But they were there for me every step of the way.
You know what? Listen, I always say, if you call your healthcare team and ask them questions, you're allowing us to do your job. Maybe if you call your neighbor and ask them questions, you're bothering them. But we love those questions. That's what we live for. And every HCM patient's journey is a little bit different. So you have to keep your healthcare team informed. And based on your needs, your symptoms, ages, preferences, things are going to differ. And that's why it's important to have that open and honest discussion, because options will vary in priority and preference. So Kim, is there anything else you can tell us about your experiences working with your team and maybe tips for our listeners?
Absolutely. My biggest complaint was shortness of breath, because I was very active before I was diagnosed. So it made a huge impact on what I was doing. I would go to the gym 5 days a week. I would lift heavy weights, and working out is very important to me, just to keep my strength and health. And I noticed that there was a decline in my capabilities of lifting weights and doing all of those things. So in hindsight, I wish I would have been diagnosed a little bit earlier, but I didn't know. I just thought it was, the golden years approaching, not be able to do the things that I used to do when I was a little spring chicken. And even going to the pulmonologist, taking all those inhalers, they weren't useful, they weren't helpful. And I just thought, well, this is just going to be the new life I'm going to have. And so I had to suck it up. But that wasn't the case. And I'm very happy that my previous cardiologist exposed me to a different treatment plan and seeing Dr. Kettleson. If you're out of breath, just keep pushing. Talk to your doctor, communicate. Being short of breath isn't always going to be your lungs. I'm not a doctor, but I can tell you with the obstruction, it all makes sense. And you got to be the boss of your body. You got to be your own advocate, but just keep asking questions. And if you annoy them, that's too bad.
I'd say if you annoy them, maybe you got the wrong healthcare team, because your healthcare team should never be annoyed by your questions. That's our goal. And as you said, it is wonderfully satisfying to have a diagnosis for symptoms that leads to an effective treatment plan. That might not always be the case, but you should expect that in any interaction with the healthcare team, it ends with understanding. That understanding might be that there is not a diagnosis, that this turns out being your new normal, but you have to trust that that's the case and feel like your healthcare team has gone to the ends of the earth to give you what you need. So Kim, I love that perspective. Healthcare is a two-way street. I'm going to wrap it up by telling people to be specific with their doctor and healthcare team when they talk about their symptoms. Don't downplay them. Don't brush them off. It can help to keep a log or record when they happen, what the triggers may be, how bad they are. And also talk to your healthcare team about what your goals are for quality of life, preferences for types of therapy. Kim wants to snowboard. You or I may not be that adventurous. You may have different goals. Maybe you want to run long distances. Maybe you just want to go up a flight of stairs. And tell your doctor what you're most concerned about. Like Kim, I don't want to be a grandma with a wheelchair and an oxygen tank. That's important for us to know so we can work together. Share your goals and preferences so you can be an active part of the decision-making process for your treatment plan. And finally, be empowered to share your concerns you may have and ask questions. You are never annoying your healthcare team with questions. You are allowing them to do their job and fulfill their vocation of providing you with the best care. Kim, this has been a great discussion today. Thank you so much for joining me.
Thank you for having me, and you got to take care of yourself.
Awesome. Well, I can't wait to see you next in clinic, and thank you to our listeners as well.